All right, now we're jumping into some post-breeding um kind of things that'll happen after we breed them. Um, the most common problem or concern, or one of the most commons is twinning, which definitely is more common to occur in draft horses and thoroughbreds, but draft horses. And that's when they ovulate multiple follicles during one cycle. Up to 25%. So that's a, fairly high amount will what we call double ovulate. And whether that's two follicles on one ovary or two a follicle on each. And then every now and then you can actually have three follicles ovulate and get triplets. Um, because they do have a larger uterus, excuse me, they're more likely to carry the twins to later in gestation, or even to foaling. So, you know, really, we don't want twins. The risk to the foals, the risk to the mare, are can be, we can lose all of them. Um, you might lose just the babies, but your mare, there's so much trauma that she can't carry again. So we really don't want the mares to twin. So we do really want to check them, especially if you know ovulation around 14 to 15, 16 days after ovulation. If the mare double ovulated or, and this again, if you're checking her before you're breeding, then you're gonna have an idea, oh, is she gonna ovulate this one too? Because sometimes they will do what's called an asynchronous ovulation, where they ovulate one, you breed them, great, and then they might ovulate. They have another follicle that looks like they might ovulate it. Sometimes even 2 to 3 days after that first one, depending on the semen, they can get pregnant with that second one. So if I know a mare or I suspect a mare double ovulated, then I may even check her, I'll check her at 14 or 15, and I may even come back sometimes even 17, 18. And I had one this past year. We checked her later. We checked her at 17 days. She had the one, things were looking good. I came back for a heartbeat check and she had two. So some of them will even go, again, just kind of depends on the growth of the embryo, because they can kind of lag a little bit. Um, so it's important to have those mares checked more frequently if there's any suspicion of kind of multiple ovulations. The earlier we can pinch one, um, the either the better chance that the other one will survive and carry to term. Worst case, you lose both of them. You still have the opportunity to rebreed her that year. Otherwise, the further the mare goes in pregnancy with twins, the more risk to her, as well as kind of the more, if you do go and try and um, terminate one, the more likely you'll end up losing both. The more expertise is required in terminating the pregnancy as well. So it just, your risk and costs go up dramatically. So if we can catch it early, that's the best way to treat these. Probably one of the other than twinning, um, the persistent post-breeding endometritis. And this is, probably what we're dealing with a lot, especially in relation to infertility. And this is when, for whatever reason, the mare is unable to clear, excess fluid and debris. Um, so they normally are going to they have a normal inflammatory response. They're supposed to produce some fluid post-breeding, that clears out any of the semen that's not viable. So it's a normal response. The problem is when mares either have too much of an inflammatory response, or they're just unable to, within 24 hours of breeding, um, that fluid should be cleared out. And some mares just kind of it persists for longer than that. The longer it persists, the your chances of establishing a pregnancy decrease. So that embryo is going to be, it's going to go into the uterus about 4 days after ovulation. So you want that fluid cleared out before then. Otherwise, you may have a pregnancy, but it's not going to be able to establish itself. So we'll start, like I said, you can start as early as 4 hours after breeding. If it's giving oxytocin, if it's going back and re-ultrasounding that mare at that point, going ahead and starting to lavage her. If you know, hey, this mare tends to just have a really strong inflammatory response. Like I said, I'll go back 4 hours later, check them, go ahead and start lavaging them at that point. Typically, we're starting with, especially if it's just an inflammatory response, just warm sterile saline, and then start to use some oxytocin as well. For a lot of these older maiden mares, one of the biggest reasons they have this problem is that cervix, it hasn't gone through the hormonal changes of parturition. So it actually starts to get a little fibrosis. So, post-breeding, it's not quite as open and relaxed as it should be. You can do some digital dilation of the cervix to help kind of stretch it out so that, again, hopefully the fluid will clear out better. And you can use some drugs as well. Some sterile, actually misoprostol. They have it as a paste. You can put on there too to help. Again, anytime we're going in, we want to make sure we're as clean as possible so we're not taking anything bacteria-wise that has then the potential to create an infection. Because most of this is, again, just an inflammatory response, and their body is just being creating too much inflammation. So it's not always necessarily an infection. Um, Kind of along these lines too, again, your older mares. So, and maybe not even your older mares, but even ones that are overweight, tend to have more of this as well. And just remember kind of if they are significantly overweight, or they have things like metabolic disease, Cushing's, they're more prone to a kind of pro-inflammatory state. And so they may be more likely to have the post-breeding endometritis. Often, the longer that kind of inflammatory cells, kind of fluid buildup is there, the more likely they are then to get secondary bacterial or fungal infections. And again, draft mares do seem to be more susceptible. I think some of it has to do with anatomy. Again, especially if they've had a few foals, that uterus does tend to kind of fall over the brim of the pelvis. So, the body of the uterus then is kind of hanging lower. So just gravity makes it harder for them to push some of that fluid out. Um, and that's where the assistance of doing some oxytocin um, can help, again, with the kind of contraction of the uterus to clear that fluid. Um, we'll even use the estramate, as well to get some uterine contraction. Uterine lavage, definitely, one of the things we're taught is, the solution to pollution is dilution. So we go in there with fluid, we decrease, the amount of inflammatory cells by using the sterile saline. We can help decrease, further decrease their response. Again, the acetylcysteine, sometimes the DMSO, the tris-EDTA, all of those can be helpful, especially if the mares, um, if kind of their fluid has, a lot of extra mucus in it. So we can use those as well to help kind of break things down. And then occasionally we will use some steroids to help decrease kind of the inflammation, that inflammatory response. Sometimes we'll use those like at the time of breeding. Um, and there's a lot more newer therapies. We're really looking into, the PRP. There's definitely stem cells, even some of these immunostimulants. So again, with all of this, there definitely is some cost involvement. But the idea with those is that you're decreasing inflammatory response. You're using, the body's own factors to help do that. And as well as you get some repairing of the tissue as well. And then, of course, with all of those, you don't have any of the side effects that come with using steroids. Um, Record keeping is very, I think very important, especially because if you've got some mares that either didn't get pregnant, especially for those mares, I think the record keeping is really important. Um, so when is my foal due? Um, how do they tease? Um, what are the palpation records? Like all of that stuff is very important to figure out, well, potentially why isn't she getting pregnant? Why are we having trouble carrying to term? Um, as well as just then you being ready for when that foal is getting born. Um, so the more information you can have in those records, just the better prepared you're going to be able to be. So, management. So we've bred mare, now we're pregnant, kind of now what? And again, kind of gestation and development of that foal. So your average gestation period is 340 days, roughly 11 months. The horse is unusual in that they have a very wide range. So anywhere from 320 to 370 days can be normal. Um, Lots of things factor into the length of pregnancy. The age, what time of year she was bred, nutrition, breed, um, even the fact of if is it a filly or a colt, those kind of things. Can all the how much light she's being exposed to. You can actually, again, kind of going back to the using the light, that can actually shorten the pregnancy just a little bit. Um, Most draft horses on average are about 334 days. Um, but if you're shorter than 320, typically we're worried about things like prematurity. Even then, too, you're a little concerned about did they have some sort of infection? Um, so definitely the foal is at pretty high risk with those, developmental as well. Um, every now and then you'll get some mares that actually will go consistently like 12 months. Um, Again, that's just kind of, once you have a mare but you do worry the longer they go, um, of the higher risk there is of dystocia, just because that foal is getting bigger and bigger. Um, I have a handful of Arabs that consistently go 12 months. I've not had, and donkeys tend to go a little bit longer too. I've not had a draft horse that went that long. So I think they actually tend to go, like I said, a little bit shorter, but definitely if for some reason they're going longer, your risk for dystocia increases. So definitely want to have the vet just check things out, and at some point maybe even get involved and decide as do we need to induce the mare. Um, so that first trimester, upwards of 114 days, um, officially the embryo changes from an embryo to a fetus. This is probably one of the most important times. We tend to see the most embryo loss. Pregnancy loss is usually in this first trimester. If you can get to a heartbeat, usually somewhere between that heartbeat check at 25, 30 days, into that 100 days. Usually, if they're losing them at that point, there's probably something is, you know, genetically wrong with the baby. So, at that point, but again, kind of when we lose the pregnancy can give us clues as to kind of what was going on. Um, and you can also do some fetal sexing during this time as well. Um, the first kind of nutrition, you really aren't going to want to feed her any different at the first and second. We really kind of want to keep things the same as long as she was in good body condition um, at that time. Ideally, we want them somewhere between a 5 to a 6.5. Again, I would say if you're getting a body condition of 7 or more, you're starting to kind of get into a pro-inflammatory state. And we don't want them quite, getting quite that big. Um, the second trimester goes up to 226 days. Um, and so, the fetus doesn't grow super fast. So we're only growing about 2.2 pounds per day. I tell a lot of owners you can keep riding her, just don't increase her workload. Kind of keep her at whatever she was doing, keep her moving, keep her fit. All of that's going to help, um, when parturition comes around. And then the third trimester, at that point, the fetus is going to start growing quite a bit, at about a pound per day. Um, and then, the foal should be about 9 to 10% of of the mare's normal body weight. And then roughly, a German Shepherd, I'd say most of these draft foals are going to be probably a little bit bigger than that. Kind of the bigger German Shepherds, 100 and 130 to 180 pounds when they're born. Um, I definitely have had a few that have been over 200, but I will say those were all some dystocias that I had. But that last trimester, carefully, it kind of again depends on your mare and her body condition as it is. But you may need to increase her caloric needs a small amount, nothing dramatic. We're not bumping her feeding up. We're not feeding her like twice what she normally was, but and definitely want to make sure plenty of vitamins and minerals. I know we were talking about the selenium, vitamin E. Those are important for lots of things, and we are seeing um, a lot more of deficiencies in those. And I don't know if we're just testing for it more and finding it more, but definitely something um, to remember, or if truly our pastures um, are decreasing in quality, but something also to consider. But definitely make sure they're getting a good vitamin mineral supplement, and you may need to increase the nutrition calories a little bit, as well as fat. That's a good source of um, increasing calories. Um,
Let's see. Olga asks, is there any benefit to late gestation ultrasound scans closer to term? Is it possible to determine if there's an increased risk for any foaling complications from a late gestation scan?
Yeah, I think they can be helpful. I mean, one, hey, just make sure kind of baby's in the right position, position presentation, kind of, hey, make sure you don't have a breach. Because, late enough, a late gestation, like they should be turned to where, you can feel skull and legs. Um, so I think it can be helpful. I don't do a lot of late gestation ultrasounds, but you can also, say you had a mare get pregnant and you really aren't really sure when exactly she got pregnant. There are some studies, granted they were done in light breed horses, but that where you can measure the orbit of the foal's orbit, and then estimate where how far along they are. So, while granted there would be some extrapolation into drafts, I mean it still I think can give you an idea. Um, so that can be helpful too. Um, definitely if there's any concern of infection, anything like that, then that's probably why I'm doing most of my late term ultrasounds is to check for, what do my fetal fluids look like, your CTUP, that combined thickness of the uterine placental. Um, we're measuring that. So can be very, very useful in those regards, yes.
Um, so sorry, I got kicked out of Zoom and had to get back in. Heather asked, I feed Purina 1212, looked at the contents compared to the Mare Plus and the Grow Cold, and it appears they're very close. Would you say it's safe to switch pregnant mares to the 1212 as well as foals?
Um, and I'm not too familiar with the 1212, that one, but
Yeah, I'm not familiar with that one either.
yeah, I mean, I guess, one thing to remember though, with any kind of switching you're gonna do, or if you're gonna do any kind of switching, is do it slowly. Usually over about 2 weeks, um, to switch their feed as well as, um,
She says it's a complete vitamin and mineral supplement.
okay,
Um,
the 1212 is a complete, okay. Yeah, I mean, if that's all it is, then I wouldn't have any concerns with having,
she said they're very close, so I
yeah.
would think one, I don't know who.
One thing I would say too is, and I'll be the first to admit to my clients, there are so many different types of feeds out there, and I can't know, about all of them. So if they ask me one that I'm not familiar about, most all of these, especially if you're talking about like Purina, most all of these name brand, Triumph, Pro Elite, Neutrina, like all of them are going to have nutritionists on staff. And most of that is all free. So, I will always, I will definitely recommend, if clients are asking me about a one I'm not familiar with, either, hey, send me the, um, analysis of it and let me take a look, or, call their nutritionist on staff, and ask them as well. Um, so, I don't think you can ever go wrong with, like I said, calling them too if you have a question. Or, like I said, take a picture of the analysis of the feed and shoot it to your vet and have them take a look. But no, if it's, and see, that's not, I wasn't thinking it would be a vitamin mineral supplement. So, um,
I was
I,
thinking like 12%, but yeah.
yeah, I wouldn't have any problems with having a full on a good quality complete supplement like that. Um, Again, this is kind of a how we're coming up with our body conditions. You really want them at that 5 to, like I said, 6.5. Not to say they can't get pregnant with lower body conditions, but it definitely is going to affect the growth of the foal. They might be more prone to issues. And same thing too, if you have an overweight mare, that actually kind of the more overweight they get, you have just as many problems getting those mares pregnant as you may with a mare that's underweight. So you really want them kind of at that 5 to 6.5 body condition score. Your overweight mares are also more prone to dystocias. So something else to consider. Um, the biggest thing with gestation is I'm not typically increasing, my grains. I really typically am trying to get owners to feed them higher quality forage. Um, whether that's, access to grass, pasture, um, hay pellets, that kind of thing. It's, really that's what I'm having owners typically increase. And that forage should constitute at least 70%, if not more, of their ration. Um, you can definitely test your hay, and for most places, it's not terribly, terribly expensive. If you've got pasture and you've got a decent amount of pasture, it's also worth, testing your pasture. And most of that can be done through your just local co-ops. And that can be helpful too. We'll talk about this a little bit more later, I think. But, fescue hay and fescue pasture, if you have that, definitely that's a huge consideration for late gestation because that can be problematic. So also kind of just knowing what type of hay you have and what type of pasture you have is important. Um, and then we talked about too the comprehensive vitamin and mineral supplements. Um, and yeah, you want one that is kind of covers, everything. Um, you can also add in some just plain white salt. You can do the site, like the blocks. Um, the hard part there is I do think you get some that don't touch them at all. So, I personally do like just putting stuff like that directly into their feed. So I know, yes, they're getting it. Everyone's getting it. Um, but that is just one more step in feeding them. So that can be a little hard. And then their protein requirements are going to increase at the end again while that foal is doing most of its growth. So you do want to have them on a slightly higher protein. I really have to admit, I don't feed um, much more. I don't recommend protein more than that 14 to 16%. Um, so that's a pretty good average. Um, so I guess one other going back to nutrition a little bit, I have had good and like supplements. I have had really good luck if you've got an older mare, or even an older stallion, or just a stallion that's maybe his fertility is a little, semen quality is a little low. Definitely if you're doing an embryo transfer, kind of advanced techniques. Um, I will say that Platinum Repro Vet supplement, I've been very happy with adding that in. It is expensive. I'll be the first to admit and agree, yes, it is expensive. But if you're going to spend that money to do embryo transfer, to do ICSI, OPU, if you're going to do that, it is well worth it. And they do have the studies that show how it increases, pregnancy rates. You get better quality embryos. Your semen factors can definitely increase when they're on that. They've done a lot of the a lot of the research behind, there is a lot of research behind it, and I do think that is a good one. Like I said, especially if you're going for kind of the more advanced breeding techniques. Um, Definitely you want to make sure that you're keeping up with your vaccines, and that all depend on just where you live and kind of what is recommended or if there's anything extra that's recommended. Definitely your tetanus, West Nile, Eastern and Western encephalitis for sure. Um, and then there is the pneumabort or herpes 1, rhinopneumonitis, typically done at 5, 7, and 9 months of gestation. Um, and then typically we do some pre-foaling vaccines about 4 to 6 weeks before they're due to foal. Um, and then as well as the deworming. So yes, ideally I love, definitely stress fecal egg counts. And then deworming about 30 days prior to foaling, as well as even after foaling to decrease any kind of spread of parasites or transmission, excuse me, transmission of parasites. And again, kind of going to depend on, like strangles. I typically only do that if you have a herd where it's endemic. Occasionally I have had a few where we did like some lepto. So you have some others, but they're going to be that you might do on your mares, but it's going to be again, um, just based on kind of your location and what has happened with your herd. But at least these are good to do for every mare. Um, and you want that pre-foaling vaccines. The idea with that is that then the antibodies are going to be at the highest level there in that colostrum for the baby. And so that way you're, doing your best to protect that baby as well. So pregnancy checks, this part kind of depends on, the mare, any history, pregnancy losses, things like that. Definitely that 14 to 16 day post-ov, confirming the pregnancy, checking for twins, making sure everything looks good. Sometimes too, these older mares, we're trying to see, do they still have a really good CL, or is there some concern that looks like, hey, maybe they might have some progesterone, a decrease in their progesterone. So, that's also helpful here at this point. Um, and again, especially in these older mares or mares that have lost them, we'll check those levels and then supplement them if for some reason they're low. Um, 28 to 30. So around there, we can start doing our heartbeat checks. Um, and two, at that point, if for some reason the mare lost the baby, we have the potential to figure out, well, why, do your culture cytology, if needed, and potentially try and rebreed her that season. Um, that 45 to 60. So closer to that 60, we can start doing some fetal sexing at that point too. Um, and and again, just make sure things are progressing like they should. Um, Once you start getting to 180, kind of further along, most of the time at that point, we might just go in rectally. We're at that point kind of just ballotting, and we may or may not be able to feel the fetus depending on where it is. A lot of times you can just see there's fluid in the uterus, but you may not be able to see the fetus because we're over the brim of the pelvis and just too deep. Or you can do a transabdominal ultrasound at that point. And again, see the fetus that way. And then once you start getting further along, kind of going back to the question of the late gestation ultrasounds, definitely any signs of placentitis, we're doing them. If the mare's had a placentitis before, always good to kind of just, hey, go in and check, make sure things look good. Any concerns, yes, we're doing them both rectally. And again, looking at that C-top that we're measuring, with that combined thickness of the uterus and placenta, as well as transabdominally, checking from there. You can also check like fetal heartbeat that way. Again, fetal fluids, things like that. So, um, yes, for those high risk mares, they are getting checks later in pregnancy. Um, any questions so far on kind of the pregnant mare?
Okay, we've got one from Rebecca. We and several other breeders we know had multiple losses this year occurring after the 30-day heartbeat check, but before the 45 days. What kinds of things would you be looking for in a situation like that? We did, of course, do cultures and treat any infections, but it seems like an odd time to lose the pregnancy, or at least not something we've experienced before.
Yeah. Um, no, you're right. It is a little bit unusual. Um, Not one of the more most common times. Um, I was that with different stallions or was that with all the same stallion or um
Yeah, we had that. We saw that across three different stallions that we used, and a
okay.
couple different breeds, mares that were open, mares that had just foaled. So it was just very strange.
Yeah. Um yeah, I mean definitely, and I don't find truthfully that a lot of mares, not a ton of them have a low progesterone, but definitely that's a something to check for sure. Sometimes too, I know definitely I've put those mares on Regimate, even if their progesterone levels are normal, just to help, try and keep that uterus environment as quiet as possible. Um, Realistically, were they older mares by chance, or the age kind of varied, or
Um, the age varied. Most of them were younger mares who had had, two or three foals in the past.
okay? Um, yeah, that is interesting then too, because definitely, the older mares, I think a lot of it for them can be just, truly there's something wrong with that embryo that, it never was going to survive. Um, Did y'all do any kind of you said you did like some culture cytology. Was anything weird on that? Like, did y'all come up
We
with it?
did we did culture our own herd. I don't know. Like I said, I brought it up because I had talked to probably three or four other breeders that were having losses at similar times, which was just super weird to me.
Yeah,
Um, but yeah, the one was clean, the other one was dirty, so she got, all the
yeah,
treatments. But yeah, I was just curious if there was any red flags you would be checking. We don't typically test progesterone simply because we've never had an issue. Usually, they're either not bred or they're pregnant, and if they're going to lose it, it's 5, 6, 7 months along for some reason. So
yeah. Um, I mean, even the kind of going back to like the Eastern tent caterpillar, like that can definitely cause some early embryonic loss too. Um, and that stuff like that wouldn't show up necessarily on, most of your like your culture cytology. That isn't going to show up there. So there are some, definitely some external factors that still could have played a role. I think sometimes finding out what they are can be difficult though. Because it wasn't until well um, after they suffered so many losses before the industry figured out that it was, um, about the caterpillar and that, the reason for the losses that year. Um, So I don't know too, that might be something to kind of think about. Was there anything insect wise different or anything different, um, with pasture? Was there a different weed out that maybe you haven't had before? So you might look kind of, especially if you had multiple mares kind of across the board, you'd want to be trying to find something that they're all being exposed to. Um,
Yeah,
but
that makes
just
sense.
nothing, not one thing that I would say jumps out. Those are hard um, to kind of figure out why. And I will say, unfortunately, I do think sometimes breeding, we have fluctuations where, you just have years where it seems like hares just aren't getting pregnant or you're having a lot of issues. And, um, I think maybe that I don't know that we always have a good explanation for those. So there's got to be something more, um, again, kind of environmental that we don't know or can't explain well.
That makes sense. Breeding horses is so fun sometimes.
Yeah, it's yeah. Um,
Um, Olga has some really great questions, more related to parturition. So I think, Olga, I have your questions here. I have probably timing with the slides that are coming up to address those particular issues.
Yeah, yeah, that sounds good.
Okay. Yeah, because I know she addresses placentitis here shortly. And then one's about ivermectin and foaling. So we'll get there. And the other one was tendons and stuff. But anyway,
okay.
we got you, Olga.
Ideally, pre-foaling, kind of your pregnant mares, if you've got multiple, kind of they should be housed together and away from, your high traffic areas. So especially if you've got pregnant mares, some horses that are doing some showing, things like that. Excuse me, you want them separated. Um, Definitely want them turned out a good bit, at least 6 hours per day, if not longer, if not quite a bit longer. Um, you know, movement is, for lots of reasons, is very helpful, especially the draft breeds. Lymphatic drainage, just that, ability for them to not get stocked up in their legs, especially the further along in pregnancy they get, especially if they have joint issues. Movement is very helpful in helping with any kind of pain associated with overall joint health. Definitely your metabolic horses. Again, movement's going to help, keep your insulin levels a little bit more normalized and, again, kind of weight. So, being able to move around, is just going to be overall, better for the mare if they can do that. Again, kind of low traffic areas. If you have, people coming over a lot from different farms or coming to visit, try and have it where they're not going around your brood mares or they have got to step in kind of a disinfectant bath, just decrease the chances of anybody bringing something in. Ideally, you want them to, if you are going to move them to a separate area to foal, you want them there for about 4 to 6 weeks. One, that way they can just settle in, be relaxed. Any kind of stress can have some effects on foaling. It also allows their immune system to kind of build up any kind of antibodies that are in that area, especially if it's somewhere that they're not used to being. So say you're taking a mare, she's high risk. You've just done a lot to get this mare pregnant. You want everything to go well. You're taking her somewhere to full out. Ideally we want them there a month and a half ahead of time so that immune system can produce those antibodies for the foal. Um, and that way they are decrease any risk to the foal. And then going back to the fescue. So if you do have fescue, ideally we want to take them off that pasture in late gestation. There is um, the toxin is the or ergovaline, and it can cause abortion, prolonged gestation, a lot of red bags, definitely dystocias, and agalactia as well. You can get there is an endophyte free fescue, but if you are planting that, but if you don't know, and even if you do, um, I think it's just better to play it safe and take them off of fescue those last at least the last 2 months. If you can take them off the last three, that's even better. And then to treat that, say for some reason, um, you forgot, you didn't realize the hay you were feeding was off of, it's a fescue hay. We treat that with domperidone. So again, kind of if you are going to have your mare foal out in a stall, at least, I would say for a light-sized mare, a 12 by 18. I think for a draft mare, a minimum of 12 by 24, or even a 20 by 20. The bigger area they have, um, the less likely, they have more room. I think sometimes you get them in these smaller areas, they can't move around quite as much. And of course, they're more likely to get into a corner where it makes it hard if they do need help and assistance, hard for you to do that. So having a little bit more room for them to move around is better. And again, um, just helps with reducing um, kind of the typical stocking up that we see, especially in these draft horses. They're big, they have more weight. The baby weighs a lot more. There's a lot more pressure on those lymphatics, especially in the hind end. So they're more likely to do that stocking up, especially closer to foaling. Um, Clean straw is great, especially like right before foaling. I have to admit, I hate it when I go into like I have a dystocia and the mare's in a stall with just shavings. Like they are just a kind of a nightmare. They seem to just get on everything, whereas the straw, I think is a little bit better. And then once the foal is born, you can always take the straw out after about 24 hours. But for the foaling itself, I do like straw, or straw on top of shavings. But pasture is, I have to admit, where I prefer if I had a choice. I think it overall can be cleaner, as long as it's not super muddy outside. Obviously, that's sometimes a huge concern, or cold, depending on time of year that the foal is born. Um, but it also gives plenty of room for the mare and the baby for the actual foaling. Um, If they are outside, or have access to pasture, make sure your fencing is suitable for foals. So even a three-board fence, foals can lie down and roll and get separated from your mare. Um, if it's electric, they can roll and kind of get caught up in it. So those are things to think about. Um, and they do happen, unfortunately. Um, And then two, just kind of be aware too, where you are, as far as kind of predators. Um, Most of the time, definitely we see a lot of coyotes that come and get the placenta, but that's always a huge concern when I have clients that foal their mares out in the pasture, but they're unattended, or then it's the big question, where's the placenta? Which is, always a little scary. I like to make my owners, I just say we're gonna check because I don't want to miss it. And if then I do my vaginal exam and hey, everything feels good, great, I can sleep better. But you know, um, they definitely will come and get that.
Olga asked, do you recommend adding straw to a foaling paddock as long as the ground is dry?
I don't think you need to as long as the ground is dry. I mean, you can, but I don't know that you need to. Um, so if it were muddy, then yes, I definitely would. Um, but if it's dry, I think you're okay to not.
I'm asking because our mares are in the dry lot, with us watching for fescue, so it's not a grass surface,
Okay,
and it can be pretty hard and maybe
I
a little bit
gotcha.
rocky at times.
Okay. No, in that case, yeah, yeah, and especially if you do have some like rocks in that, here or there, then no, not a bad idea too. I see what you're saying. And then too, you got to think, for some reason it's super, super dry, and for whatever, like a little dusty right then, if, say you haven't gotten a lot of rain that spring or whatnot, you don't want them to inhale a bunch of dust, right when they're first born. So yes, in that case, some straw might help a little bit there.
One other thing, I have hard ground, and these babies are, 180, 200-pound babies, and all that fluid with foaling makes it a ice skating rink for all of us. So I would recommend straw on hard ground as well
Hmm.
for that purpose.
Yeah. Yeah, it's the
Problem is getting the mare to foal on the straw.
yeah. Yeah. That's always the thing. You can lead them, but they're gonna fall wherever they want to. But then, that is the nice thing because, then you can move the straw to, help, especially when the foal is like then trying to start to stand and whatnot. At least it's there. And then you can move it and make it easier for the foal to get up and whatnot. But yeah. So lactation, thankfully we don't see um a ton of issues, but we definitely can. Um, so the mare has two teats, and then the foal usually can nurse from, either side, is kind of what they do tend to have a preference. They do tend to nurse off of one a little bit more than the other, but um, the generation occurs in the alveoli, and then it's moved into the ducts, and then those cisterns, and then from there, the baby is able to um, get the milk. So, you have colostrum, which is super important. That first kind of 24 hours, really the first 12. And that is what's going to give the baby all of its immunity for the first few, months of life. Um, so around 12 hours, that colostrum is going to start to decrease and change from colostrum to milk. Um, and as well as the foal's GI system is also going to change, and so they won't be able to absorb the IgG from the colostrum too. So really, we want them to nurse pretty quickly, and this is why. Um, so and then eventually, so it's going to turn from a kind of a pretty, usually kind of yellow amber color, kind of sticky to more the traditional white milk color. And um, definitely the structure of her teats are kind of will influence how the foal is able to nurse and everything. Um, Again, we typically don't see a lot of mastitis in mares, thankfully. It definitely can happen, but compared to other species, it is pretty um, low risk.
So we had a question from Olga, and I'm not sure if this fits in at this point, but what's the best way to tell the difference between ventral edema filling the mare's bag and early bag development due to placentitis?
Ooh. Um, Well, I mean, I think the biggest thing, the bag filling, especially for a mare that's had multiple foals, some of those mares can start to fill, even 4 weeks, even sometimes a little bit earlier, um, too, depending on the age and kind of metabolic status. Um, The ventral edema, typically, that's going to be more further forward. Don't, I don't see, we don't see that as commonly with placentitis. Um, I think the biggest thing I probably would say is if you have any doubt or any question, um, have the mare checked. Other things you can see that might clue you into that, hey, this might be some, with placentitis, you're also looking for typically, again, not always, but you are probably going to see some vaginal discharge. Even checking the tail, making sure you don't see any kind of um, crustiness to the tail right about the level of the vulva. Um, and then too, if the mare is dripping milk pre-foaling, you definitely want to, especially if we're dripping colostrum, you want to collect that in anything that's clean, and save it. But um,
The other thing Olga said was she had a mare who had mastitis in the past, and one of her bags is permanently larger and firmer.
yeah.
Should I expect any lactation issues on that side?
Definitely you could, like, she may not lactate on that side. That is possible. It kind of just depends on how much scarring occurred. And it, sounds like a decent if it's firm. Um, and that's, so then yeah, now you've got one side that the foal really can't nurse from. Um, the nice thing is that the foals will learn and adjust. Um, but definitely that would be a foal you'd want to watch closely and make sure, um, does get the colostrum, and everything. But yeah, I'd be a little concerned that that side isn't going to be functional. So if it's staying hard and firm even afterwards. And some of them, over time, they can get teats that are super long, super big, that just stay. Um, and I've had some of them where those foals can nurse off of them and they do still produce, they still are able to get milk out of them, and some where just the shape of the teat the foal isn't able to actually nurse off of. And again, the other side is going to produce enough, if that's the only side that the foal is nursing out of, it will keep up, but you do just have to watch those mares more closely for mastitis or in the foals to make sure that they're getting enough colostrum and nutrients.
She did have a follow-up on that. Should she keep milk replacer on hand to supplement the foal?
Um, I mean, definitely not a bad idea. You may not need any. Again, like I said, you may not, but it probably wouldn't be a bad idea. Better to have it and not need it um, than need it and uh, then struggle to get it. Because I know sometimes we struggle to get it.
Mm.
Yeah, so we have a colostrum plan for this fall, certainly, because we're anticipating some problems with that side,
Yeah.
that had mastitis before. But should we also be watching for her for the recurrence of mastitis in that side since it happened before? Is that a risk for her?
Um, with her, I mean, yes, I would be a little worried about that, just with her since you are going to be going through foaling lactation. Um, so yes.
Okay, that's good to know. Thank you.
That's all we got for lactation on that. Questions so far.
Um, So development, you know, don't forget your maiden mares. They may have absolutely no development, and that can be completely normal. A lot of times those maiden mares, they don't actually get any udder development until like right after the foal is born. Um, you definitely, with maiden mares, I really don't use my udder development as kind of any kind of predictor of when they're going to foal. Um, so if it's more than 6 weeks prior to foaling, definitely at that point, I'm wanting to check. I think it's never a bad idea just to check and make sure, hey, do things still look good? Let's just keep a closer eye on this mare. If it's before that 6 week mark, definitely the risk of placentitis is increased. And then two, you may see some secretions from her teats, typically kind of watery clear the closer they get to foaling, more that amber sticky color consistency. Um, and then waxing, again, that can be a little tricky, um, foaling is coming soon, but I've had some that'll wax, like I said, up to 2 weeks before they actually foal. Your, again, maiden mares may not wax at all, um, but it definitely means you're getting quite a bit closer. Um, the colostrum, kind of like we touched on earlier, that's that first secretion that's coming. Very, very important. This again is kind of what is going to protect your foal those first few months. Lots of things too that are then going to help them be able to digest the milk as they then start nursing because everything, um, in the first few months of life, all of their nutrition is coming from the milk, especially the first like 2 months. Um, so we want them to ingest that colostrum, ideally within 12 hours, definitely by 24. Um, IgG is the big one we're looking at, as well as you get lots of proteins, vitamins, um, as well as kind of the lipases and proteinases, again, that help in digestion. Um, so kind of 1, 2, 3, we want the foaling should happen in an hour or less. Definitely, or they should stand within an hour. They should nurse within two. And again, I tend to be kind of aggressive. If they haven't nursed by 2 hours, I want to be out there and seeing the foal. Because I want to know, well, why aren't they nursing? Is it that they're just a little slow? They need a little assistance. Are they having trouble latching onto the teat for some reason? Is there something with the shape of it that they need some assistance? Or is there something more going on? So again, I don't like to wait. I don't think there's ever a reason to kind of watch them struggle for much longer than those 2 hours. Definitely, if they're going longer than that, I will just milk the mare, get that colostrum, and tube the foal, and that way we know it's getting in. We know they got it, and we're not going to then have to hopefully deal with any kind of failure of passive transfer. I guess this one. The only thing I would say on here is I am personally not a fan of bottle feeding. I know a lot of people do and don't have issues. I think, probably just because I see the ones that do have issues. So with, most of the nipples that are available on the market for bottle feeding or for designed for, cows, cattle, and then goats, and the shape just is different than a mare teat. And so sometimes the foal just can't quite get the right, kind of suction on there. And so they are at an increased risk for aspirating. So just be very careful if you are going to bottle feed anything. And then definitely long term, there are a lot of behavior issues. If you're talking about bottle feeding, say something happens to your mare, there are lots of reasons to not bottle feed, and to go to other bucket feeding, and that kind of thing. Um, so some issues we do see, again, thankfully not very commonly. We're pretty fairly lucky with mares. Definitely mastitis, definitely can happen for sure, especially if, say the foal is sick, and isn't nursing the mare. That's probably where, um, where I see mastitis in postpartum mares most commonly. Um, and that definitely can be an issue. Um, they will get hot, painful. The discharge can even start kind of turning a chunky, instead of that, just white, clear, or white, thin kind of fluid. Um, then you can also have mares again, that don't produce any milk. And again, we treat that with some domperidone. Typically, we most commonly see that, with mares that have been on fescue. So if they do have some excessive swelling, edema, um, you can definitely do some compressing. Obviously being careful, some mares will be pretty sensitive and try and kick both the foal. And that can be another thing, especially maiden mares when that, milk is first coming in. It's uncomfortable and they'll squeal and kind of kick at the foal. So sometimes just, light sedation on the mare so the foal can nurse, holding her, keeping her more still, can help prevent, that way the foal can nurse and help prevent mastitis, can be helpful. Again, the malformed teats, we don't see those a ton, but they can happen. Again, makes it hard for the foal to latch onto. And thankfully, neoplasia, while it does happen, is, I'd say, rather rare in horses, especially compared to other, species. Um, oh, and the dirty udder, yeah, definitely. I think it's always a good idea to just have the udder kind of washed, pre-foaling. Um, Nothing super aggressive, just some, warm water is fine just to kind of clean it, and that way, um, uh, the foal isn't exposed to anything, um, they shouldn't be. Any questions right now? Are we
Brian asked a question about the Madigan squeeze, but I think that's coming up in the pregnancy hazard
okay?
stuff. So,
Yeah. No, that is very useful for sure. So, um,
I think also Olga, before we move on to the actual parturition, Olga asked about, do you recommend giving mare ivermectin on the day of foaling?
not on the day of. Um, I mean, I know I definitely have had some people that do it. I don't think there's much, like there's I don't think you're going to hurt anything by doing it. But like I said, typically the way I do is kind of 30 days before and then 30 days after. But two, I think that depends too if you've got a specific parasite you're concerned about or have had issues with in the past. Um, there are some that can be transmitted via, milk. So if that's been an issue, then, it might be kind of a thing where, hey, you need to do it for your farm. So, again, I don't think it's, you're not going to hurt. It wouldn't be wrong to do, but, I think the 30-day before, 30 days after foaling has worked well.
Okay, yeah. I'm asking because, some older breeders just kind of have a way of doing things, and folks
Yeah.
are suggesting, every time, the mare falls, you give her a tube of ivermectin. But if I read about it, it seems like maybe the modern day guidance is a little bit different. So I wanted to
Yeah.
ask.
Yeah, I mean, deworm, gosh, people get, pretty passionate about the different deworming and like rotational versus egg per gram. And they're definitely I'm try and deworm as infrequently as possible while still doing it to cover the foal. But yeah, yes, there are lots of opinions out there. I think too, the AEP, they came out with some new deworming guidelines fairly recently, maybe 2 years ago. And that's always I think that's a great resource for you know, the entire herd. And that's where I get a lot of my recommendations are from that one. But it should just be on like their website, the AAEP, and they should have like guidelines for vaccinating and then deworming. Um, and that's based off of, the newest research and in trying to decrease resistance because, we're not getting any new dewormers anytime soon. So we want to make sure the ones we have are effective. Um, so, so what are some complications, albeit thankfully un rare, that can happen? Um, Definitely some things that can happen. You can have uterine torsion, ruptured uterine arteries, dystocia on juvenile or strain, just in general on juvenile mares, hydrops, and then prepubic tendon rupture. Um, Again, thankfully, these are not common, but when they happen, they're usually pretty significant and severe. Uterine torsion, 5 to 10%. So, think about all the mares out there. So pretty uncommon. Typically mid to late gestation. Even postpartum, this can happen too. Again, because all of a sudden now you have so much space. So, um, usually associated with some kind of GI problem. So, it could be even a GI displacement that then causes the secondary torsion. Again, like I said, post-foaling, now all of a sudden they have all this room. Um, the severity of your signs are going to depend on really how much it's torged, as well as then the level of the vascular or the fetal compromise. If it's a complete torsion, you're most likely going to lose the fetus, just because you've cut off blood supply completely. These mares are also pretty susceptible to, say you are able to correct the torsion, in dying shortly after, just because there's such a release of endotoxic effects that kind of lead um, to them dying too. Um, so again, showing signs of colic, anytime from mid to immediate postpartum, that may or may not be responsive to anti-inflammatories and pain meds. Ideally, a standing flank is nice. Great thing about that is you don't have to put them under general anesthesia. Typically, that's much easier earlier in gestation. Obviously, the further along they are, the harder that is to do. Um, Potentially can try rolling the mare, and then of course can put her under general anesthesia and do just a ventral midline. It just, you know, your risk of losing the fetus or figure, especially if you're going to those having to go to general anesthesia, do increase. It really just depends on how far along in the pregnancy they are. Um, a ruptured artery, this is definitely a life-threatening complication. Again, typically most common in your older mares that have had multiple foals. Um, they just, the collagen, that everything that makes up the fiber, the vessels isn't as strong. So those vessels kind of stretch and weaken. Um, Again, they're going to show signs of colic, sweating, kind of pale mucous membranes, kind of stressed, anxious, definitely in severe cases, sudden collapse and death. For treatment, um, you know, definitely we need to see these as quickly as possible. And um, fluid therapy, definitely I would say like prognosis is generally pretty poor for these. High drops, again, very thankfully uncommon. So they produce way too much fluid, and you've got two types, just depending on where that fluid is. The hydroallantois is the more common one that we see in horses. But if all of a sudden your mare has a super, super big abdomen, bigger than kind of normal, kind of looks like it's pendulous or pear-shaped, definitely showing signs of discomfort, that would be, a concern. Um, Again, prognosis is fairly poor for both definitely for the fetus, and potentially even the mare as well. Definitely this requires intensive management, for both of them. Prepubic tendon rupture, again, what you'll kind of see is a sudden change in shape of their abdomen. You might see a sawhorse stance. You can see this mare here. Her tail head is kind of elevated. Um, Again, just depends on how far along in gestation they are. But definitely if this happens, you don't ever want to breed this mare again, should she manage to live through this. Um, Now we're going on to abortions. So, infectious, you've got both infectious and non-infectious causes. Um, EHV1, typically the third month, the end of, can be common. And then you also have your bacterial infections, causing your placentitis, your strep zoo, E. coli. We see that one a good bit as a cause for placentitis. Um, there definitely is EVA, which thankfully isn't very common, but can be, especially if you've got, again, a lot of like young show horses that are doing a lot of traveling. And then lepto, again, that one, unfortunately, is usually you find that out after you kind of have some abortions, um, but not common, but can happen. Um, so. Some non-infectious causes, the umbilical cord torsion. If for some reason the umbilical cord is super long, you can see here in this one, this is all kind of edema, in this umbilical cord here. Any kind of placental issues, premature separation. Um, if for some reason there's a development issue, definitely twins. Typically that's 5 to 8 months that but it can, they can even go to term, and lose one or a little early. Maternal malnutrition, or toxins, kind of going back to the like fescue, can cause some abortions, and then definitely your chromosomal or fetal deformities. Typically, those are a little bit earlier in gestation, but sometimes they can go longer. I've definitely had some of those that, 5, 7 months. So they can go a little bit longer, but typically your chromosomal ones are going to typically occur earlier in gestation. And then definitely some maternal factors, something super stressful, some sort of traumatic event. Um, and then definitely, their history can play into things. Any questions on kind of abortions? I know there's a lot more. We could probably spend 4 hours just talking about abortion stuff. But any questions on that?
There's nothing in the chat. Does anybody have any live questions? Okay.
I guess one thing I'd say too that's always helpful is if you do have an abortion, or especially if you have multiple abortions, at that point you definitely want to be sending, things off, whether it's you are close enough that you're able to send the foal as well as the entire placenta, or you're sending parts. Especially like I said, if you're dealing with multiple, you need to find out why, so that you can either hopefully try and prevent it anymore, but definitely try and prevent it for next year. Um, so if possible. But sometimes, unfortunately it's just one mare and um but still, the only way to know for sure is to send some of those samples off. Um, so getting ready for foaling, kind of how to prep. There are a couple ways you can kind of prepare yourself and have a better idea. Again, that huge window that they have of when they're going to foal. So we can kind of observe physical and behavioral changes. You can do milk pH testing, and there are quite a few different monitoring devices and foal alert systems out there to help. So physically, it's just kind of knowing your mare, definitely the udder shape, even the body temperature can be a little helpful. Waxing of the teats, definitely there's pelvic relaxation. So you'll see like the vulva will lengthen, the muscles kind of around the tail head, around the anus, those will all soften quite a bit. Um, again, kind of shape of the abdomen can change a little bit. They might actually start waxing or even streaming some milk. Definitely, if they're doing that, catch it just in case. Um, so the testing, these are both nice. There are a couple different ones you can do though. The pH, as well as the milk calcium. And yeah, there's the commercial kits for those that are available. For the pH, it typically is around 7 or higher. When you have a huge drop to less than 6.4, foaling is imminent. And so I would say both of these are better at predicting that the mare is not going to foal. So if your levels are high, you know for sure, hey, she's not going to. Um, Again, kind of the calcium, if your concentrations are greater than 200, there's a really high chance she's not going to fall. But when they start dropping, that's how you know, hey, we're getting closer. And I do think they are fairly darn accurate. Not to say I haven't had a few that have had, like with that calcium carbonate, we had a few that didn't fall within that 24 hours, but they might have been like 30, 36 or something. So I mean, they're fairly accurate and definitely narrows down the amount of time you're staying up late at night. Definitely cameras. I mean, gosh, there's so many options available there. And that way too, you can watch the mare without interrupting her. Um, I've had a few of those where the mare was delaying foaling because they had to, everyone was having a little powwow trying to watch her foal because they wanted to see it. And really, it was bothering the mare enough to where she kind of held off. So the cameras are wonderful. You can watch from anywhere. And then if they are showing some signs or something you're concerned about, you can rush down there and check them out. Couple different types of foal alert systems. Um, they all work just a little differently. The birth watch system, that one's checking, the mare's temperature. The equipage foaling, that one's on her halter. Um, and then the foal alert, that one, it's a transmitter, it's sutured on her vulva. And in theory, as the foal's coming out, separates the lips, and then it sends a signal. These each have pros and cons. You get false alerts with all of them. But they're just another way, especially if you're using them in conjunction with something else to know when they're foaling. Um, so for the actual foaling process, definitely a flashlight or headlamp, probably a headlamp, just so that way your hands are free. Inevitably, these, happen most commonly at night. Not to say they can't fall during the middle of the day, but, most common. A thermometer is great. I am always amazed at how many horse owners don't have a working thermometer. Um, just the general one at CVS, nothing fancy. Just a plain digital thermometer. Mark it as your horse thermometer. Get five of them, because inevitably they get lost too. Um, Vet wrap to wrap the mare's tail, especially if you're going to be there for the foaling, just because it helps. Heaven forbid something's going wrong. Um, it just helps keep all that extra um, kind of hair out of the way. Um, a bucket with warm water, you can help clean, again, kind of clean the mare's udders. If you need to do anything with the foal, plus some towels, especially if it's cold outside or cold, but towels to help clean and dry the foal. I will say one thing with that is, that's part of that. The mare really should be drying her foal too, so don't do too much of that. That's part of what helps them build their relationship, is for her to do that. So again, I would try and leave that for her to do unless, again, they are born in a puddle, they kind of certain circumstances make it to where you need to assist with that. Definitely syringes and needles just in case you need to administer anything. Gloves, both just plain hand gloves, as well as some rectal gloves. And then sterile lubricant, um, always good to have around in case you need to do any kind of vaginal exam. Um, Betadine or Novosin for dipping the navel. Personally, I use a Novosin water and alcohol combination. Um, if you use the betadine, and the reason I've moved to that is that's what they actually use for human babies. Um, it's a little bit less irritating. Sometimes the betadine can be it's a little stronger, so it can be a little more irritating. And then add in the alcohol. It helps to also kind of dry the navel as well. Definitely the fleet enemas for any kind of foals with meconium impactions. Um, and that's personal preference. If you just go ahead and or kind of, discuss with your vet, some people just go ahead and give the foal an enema. Some people will wait, but definitely good to have one on hand for sure. Banamine, definitely have that. Hopefully you have that already. Potentially some oxytocin. You'll definitely need that. Definitely, heaven forbid, you have a retained placenta. Um, Even just post foaling kind of uterine, clearance of fluid, oxytocin can be helpful. And then heaven forbid your mare doesn't have a bag or any kind of milk production, then some domperidone definitely should be on hand. Most of them proceed just fine, and you can't even get there in time for the foaling. Um, or you're coming and the foal's already born, and so thankfully, most of them go right. About 10% do have complications, and any kind of complicated that is an emergency. No kind of let's sit on this and watch, like that's an emergency. Um, there's such a high risk to the foal than to the mare. The mare's obviously her fertility can be compromised too. So normal labor should happen very quickly. Um, Typically, that foal should be in this kind of orientation. So longitudinal presentation, dorsal sacral position. So you want that, um, and then kind of the diving, we want that foal diving out of the uterus. Um, if they're not presented like this, your risk for dystocia is high. Um, so, um, you know, let Stage one can last even a few hours, and generally at that point, the mare's showing just kind of some mild signs. She may not. Every now and then you'll get a mare that it's hard to tell she's doing anything. Um, and then the stage two, that's technically active labor. When her quote unquote water breaks. This should be no longer than 30 minutes. If it's longer than 30 minutes, your likelihood of having a viable foal decreases quite a bit, just the longer it goes on. Of course, that kind of depends too. Is the head out? Can they breathe? But yeah, that should be 30 minutes. And that's why, definitely if your mare is a high risk for any reason, that foal is worth, you've put a lot of time and money into getting this mare pregnant, having them somewhere where it will be assisted by a veterinarian, where they can do additional things to help, may be worth considering. Um, and then stage three is by the time the placenta is passed. And again, that placenta, we really want it passed within 3 hours. Um, they can go longer and be a little bit longer and be okay. But like I said, unfortunately, the mare is fairly susceptible to becoming septic the longer that is in there. Um, Again, dystocia, any type of difficult birth, and the best chance of a successful outcome really depends on prompt assessment and rapid intervention. Remember, 30 minutes, not a lot of time. Unfortunately, I know I'm in an area where I'm more than 30 minutes from most of my clients, truthfully, especially with traffic. So, if you're in the middle of nowhere and you're longer than that from a vet, I think that's worth considering. Do you send the mare somewhere or, um, and kind of look at other options? But again, just something to think about. Most common reasons of dystocia are going to be abnormal positioning, um, and then fetal oversize. Thankfully, not very common. Again, the uterus of the mare is pretty cool in that they can kind of help regulate the fetal growth. But you will sometimes still get a mismatch of the fetus and compared to the pelvis. And so, um, that definitely will cause a dystocia. And then definitely any kind of malformations. Again, most commonly contracted limbs. And sometimes those foals, they are not able to be delivered vaginally, and sometimes you have to go to C-section um, for really any of these.
That actually leads me to one of the questions that Olga asked
Yeah.
way back earlier that I held off. What's the likelihood and risk factors for contracted tendons in a foal? Is this more common with a maiden mare? Is there a way to tell if the foal may have this issue via ultrasound?
Mm. Um, I don't think you could tell that from I don't know. I've never ultrasounded one and seen that. I guess not impossible. Um, but I don't know that I would say you could consistently. I've not seen really that as a use to like diagnose that before they're born. No, I don't know that there's a ton you can do for that. Other than kind of making sure like the mare doesn't all of a sudden get like a huge increase in her nutrition at the end that then could, cause the foal to all of a sudden kind of grow quite a bit. Again, but most of that isn't, there's so many factors that kind of go into causing contracted tendons. Um, I don't know that there'd be a great way to like predict that that foal is going to have it though, unfortunately. And of course, then you have, most of the foals with contracted tendons, most of them are not severe enough. But definitely, it's those severe ones, um, that are going to cause the dystocias. Um, the foals that cannot extend that limb at all, um, that's going to be an issue. Um, the hard part too, I'll say, is truthfully, if they're that contracted, the likelihood that they would, you know, um, those have a really hard time even, surviving. Say they do make it through parturition, they have a hard time surviving even from there, just because of all the problems with that severe of contracture. The ones that are just mildly contracted, there's lots of things we can do for that, but those typically aren't the ones causing the dystocias. Um, so some common presentations and kind of just good to know. Um, again, especially if you are somewhere where vet access is limited, definitely stick a glove on, get some lube, and try and feel around and see if you can figure out kind of what the problem is. And I will say too, definitely if you have cattle, this cattle and like being able to feel a calf, unfortunately, they have dystocias more frequently than horses. And so getting that experience with feeling calves and pulling calves is actually can be useful. The other thing too is cows don't squeeze quite as hard as horses, so because the labor is not quite as quick. So you do have to be careful if you are sticking your arm in your mare. Some of those contractions can be pretty strong, and there is that potential. So definitely, be careful. But dog sitting, when those back feet are a little bit too far forward, they're coming out as well. So at that point, you really want to just push everything back in there and then try and pull the foal while keeping those back legs down. Probably one of the most common ones is this incomplete elbow extension. So you got one leg down. So, ideally with that, you're going to go in, we're using chains on these. Whenever you do, if you're putting a chain on a leg, you always want to half hitch it. And I have to admit, like, you can look up like tying knots and stuff. But you always want to do that over a joint so that you have part of your chain above and below a joint. And that way you're not going to put too much pressure on a leg and accidentally break part of part of their leg. Um, and so, again, here you kind of want to reach down, grab that hoof, um, and cupping the hoof. That way we don't accidentally tear the uterus. That's definitely a huge concern with dystocias. The carpal flexion or contracture, again, we see this quite a bit in foals that are either too large. And again, it kind of depends on the severity of the contraction as to what you're doing. But big thing is using your hand to cup the foot to protect the uterus from tearing. Definitely you got head and neck flexions, either to the side. You've got to, and there are head snares you can use to help pull that head back around. But you've got to get that corrected. And then the head or neck can either be up or down. You get into these foot over napes, these shoulder flexions, these kind of presentations. Realistically, these are pretty hard to correct without kind of advanced, definitely multiple people, as well as, putting the mare in different positions. So again, you're getting into, unless your mare is somewhere where they can be assisted immediately, unfortunately, you're probably going to lose the foal. Um, so there's manual manipulation, and that's essentially where we're assisting. We try and manipulate the foal, ideally with her lightly sedated and standing. Again, the risk for trauma to both the foal, the mare, as well as the person are there. And that's part of too why we sedate them. And hopefully that will resolve things. And there's controlled vaginal delivery. A lot of times too, we will put these mares under general anesthesia, lift their hind legs up. That's called the Trendelenburg position. The idea there is it gives you a little bit more room. You can have gravity kind of help you too to get the foal kind of back into the uterus to then manipulate them. To get them to where then you can pull them out. And then unfortunately, from there, usually you're kind of, usually what's happening is the mare is in this position. She's getting prepped for C-section by your surgery team. The repro team is back here trying to do the controlled vaginal delivery. And there's usually a set time limit. Hey, if that hasn't come out, they're rolling, you're rolling right into surgery to do the C-section. And she's already clipped and prepped for that. Um, so red bag, typically we see this, again, most common, definitely with the fescue toxicosis, quite a bit. It can happen for some other reasons too, but it's when the placenta detaches prematurely. Huge emergency because the fetus isn't able to get any kind of blood, oxygen. So, if you see this, then you need to react immediately and call your vet. You want to open that carefully, and get the foal out. And then definitely that foal is at a huge risk for dummy foal, the neonatal maladjustment syndrome. Um, definitely the foal can suffocate if they are not delivered soon enough. Definitely mares tend to develop uterine infections after these. Retained placentas are very common with these as well. And kind of lightly touching on your the question earlier about the squeeze technique, the Madigan squeeze technique, definitely um, you know, can be very helpful. It just depends on the situation. I've definitely had some good success with it. I've definitely had some cases where it didn't work. But the nice thing is it can be very useful. And especially something to try. Heaven forbid you have a dummy foal. And I think we'll probably talk about that more too with kind of the next talk. Um, um, So when you call the vet, when do you need to be really worried? Definitely any premature dripping of milk, especially too, if it looks like colostrum, for sure. If it's kind of that yellow golden, kind of sticky, but even if it's just dripping milk prematurely, call. Um, if you're close to foaling, and there's no mammary development, or you're past the due date, still none, that would be another sign. Again, one caveat I'll say is every now and you will get some maiden mares that do not develop any mammary development until like right at foaling. But definitely any kind of colic signs. Um, excuse me, if there's more than 15 minutes between the water breaking and any presentation of parts, of fetal parts, or if you only see one leg, both legs, but no head is coming, no active contractions. And I truthfully, for mares that are that I've had in for foaling out, like if I'm not seeing progress every 5 minutes, there needs to be progress every 5 minutes roughly. Then again, they're in the hospital because they're high risk, or the owners are just that concerned they want them there. So, you know, um, I want to see stuff moving even faster than that 15 minutes, just because if it's been more than 15 minutes and I haven't seen anything, well, I've got 15 minutes to correct it, so that I want to see stuff a little bit quicker. It is hard because you also have to, you don't want to just jump in if nothing wrong is going on, because again, you can sometimes interfere with the mare's natural foaling process. Um, but so sometimes it is a learning to be a little patient, watching them and not being too anxious. Because you have to remember, again, most of these happen and they don't have any problems. Um, so definitely any kind of red bag, or if the foal is not responding, not breathing, um, the foal isn't standing up within an hour, they're still struggling to stand, they're not nursing within 2 hours. The mare has a retained placenta, so anything longer than 3 hours. If you don't have a plan in place already, with your vet for kind of retained placentas or, placenta expulsion, um, have her checked. Um, Definitely, if you have a mare with a retained placenta, um, you know, temp checks on her, checking her temperature, blood work, things like that are never a bad idea. Um, you know, they will get septic very quickly, with a retained, or they can, with a retained placenta. Again, some more are just more sensitive than others, and I think it depends too. Why did they retain? Um, I've had some, again, within 3 hours, they were already getting septic. Some I had, one that had a mummified fetus, and how that mare wasn't septic, I'm not sure. But it's better to be safe, and just make sure everything looks good. Um, any question in that on those kind of the dystocia presentations and dystocias?
There's
I
none.
have a question about you said um, size mismatch isn't a common problem. Um, we did have this past year a maiden mare. She went 368 days gestation, and I wasn't sure we were going to get the baby out. We
Yeah,
did. We got the baby out. Two grown men got it out.
yeah.
And she was fine. I mean, we lost the baby. It took long enough that, but it just made me think. I mean, I know all the research says that the baby shouldn't grow too big for the mare. Is there any advantage to breeding those maiden mares to a smaller breed for that first foal, or will them not? Or are they just going to grow it as big as they want to grow it, regardless of what you breed them to?
No, and I do think you're right. Like, yes, the research says the foal should only grow to the size of the uterus. But again, there is something to, hey, this, and again, we see it, they study it and they look at it a lot more in cows, in cattle than horses. But there is definitely something to say, hey, this stallion throws really big foals. And that's something too you can ask, especially if you're trying to breed your maiden mare, like, hey, just historically speaking, what size foals are, like, roughly. And the stallion owner really should have some idea of that. Um, hey, yes, his foals have really, really long legs, and that kind of thing. And yes, I I do still kind of recommend my maiden mares, go with a stallion that is roughly the same size as them, or yes, a little bit smaller. Um,
Okay.
just because, again, the cervix hasn't gone through all those changes, the pelvis itself, it hasn't widened, all of that. So, albeit their risk is lower, it's still there. And if we can do something by breeding them to a smaller stallion the first time, to hopefully kind of take that even further out of the equation, um, why not? Um, Especially if the owner, like, especially if the mare owner is okay with that and they're not just absolutely dead set on the stallion that's quite a bit bigger. But like I said, stallion owners should be aware of kind of what size foals they are producing. And that is, something to ask them, you should be able to ask them and get an answer.
Okay.
Um, um,
I think that was well, there weren't any in the chat box about
yeah.
part tuition.
And yeah, like I said, but if they've had a foal before, say it's not a maiden mare, then I don't tend to really, I mean, again, I wouldn't be breeding like a little pony mare to a draft stallion. No, I'm definitely not going to be recommending that. But even though in theory, again, those papers say you should be okay, no, I wouldn't be comfortable with that. But if it's, you're talking about, um, a shorter draft mare to maybe one that's quite, an extra hand taller or something, then at that point I wouldn't, I would, if she didn't have problems before she's had them, I wouldn't be opposed to that. No. Um, so kind of that early postpartum period for brood mares, um, concerns here. And this goes from that initial kind of few hours to 30 days. Um, retained fetal membranes. Again, that can be some serious, you can have serious infection. Um, potentially can lead to death. Laminitis you can have especially in these draft horses, I think a huge complication that you can see. The periparturient hemorrhage. Again, the hard part there is there's not a ton you can do to prevent that. It's just reacting quickly if you're seeing those signs. Uterine prolapse. Again, that's a referral type situation. Thankfully, again, not common. And then colic, for multiple reasons. Probably the most common reason I'll see them for colic isn't true. Most of the time, it's a true obstipation. Like they truly are constipated. They're sore. They just gave birth, and like you said, like y'all said, most of these draft babies are huge. Easily 150, 200 for sure. So they're sore and they, don't want to pass manure because it hurts. So definitely some pain management after foaling for these mares can be helpful. Making sure there's no kind of trauma. There are no vaginal tears, things like that can make them even more painful. So, um, I don't load postpartum mares up on hay that first 24 hours. I kind of tell owners, hey, keep their diet a little light. We don't need to have a ton of milk production that first 24 hours. Really I want them drinking, drinking a lot, as much as we can get in them. And making sure they're passing manure. So, if they need some Banamine for a day or two after foaling, just to keep them comfortable so they will pass, that's fine. Every now and then you have to actually go in and evacuate the manure out for these mares, because they can be sore, especially if they tore or something like that. Um, so, um,
All right. So that was incredible. I know that was so much
that was a lot.
information. From conception to delivery, which was amazing. And of course, we're gonna pick it up with the second half of this, which is February 21st, and we're gonna pick it up from the foal's perspective. So we've covered everything about the mare. Now we're gonna turn our attention to the baby. And then we're going to also go over stallion management. So if you haven't registered for part 2, be sure to get online and register for that class. Because obviously, if today was as fabulous, it's going to be just as great. So you don't want to miss that. Before we log off, I want to make sure we open up for any other final questions we may have from attendees. Or if you have any general comments or anything for Dr. K.